All right, good morning, everyone. Welcome to Mark's Walk with the Doc. So today's talk is called The Inflamed Heart. We're going to talk about heat, as it's nice and hot sitting there in the sun. Sorry. So Chinese New Year occurred just after our last talk on February 17th. This year they did the Year of the Fire Horse. I don't know what a fire horse is, but it's a rare event. And apparently the last one prior to this was in 1966. It's supposedly a very high energy, big change type of year. So let's see what we can do to make some changes. So in honor of the fire horse, we're going to talk about fire today. We're going to talk about inflammation. Inflammation comes from the Latin word inflammare, which means to set on fire. Inflammation is the body's defense system, and the term is used to convey that the body is setting the body on fire to handle a stressor, something that's attacking the body. So when the body is faced with an infection, a trauma, a toxin, the inflammatory response is started. It removes the insults and helps the body heal. Now there's 5 symptoms of inflammation. I gave you a nice little chart here. At the area where there is a problem, we have redness, or rubor. It's Latin Day today. Rubor, redness, in the area of the injury. Heat, calor. So you know if you have an infection, you have cellulitis, you have an arthritis, you know that it's red, it can be warm. Heat or calor. Swelling, you know that means tumor. And pain, dolor, and loss of function. So if you have a joint pain, you can't move your arm, you lose function there. Now, acute short-term inflammation is good for the body. It's vital for protection and for healing. However, chronic inflammation, inflammation that lasts for months or even years, is harmful. It starts to break down the body's tissue. I'm getting back to the heart. How is the heart affected by inflammation? How can inflammation be detected and how do we treat it? So chronic inflammation leads to several different types of heart disease. First and foremost, coronary artery disease or heart artery disease is felt to be an inflammatory problem. And I gave you a nice picture of the model that's in our office, looking at a heart artery and what happens with inflammation and with plaque and blockages. So if you go all the way over onto the left, this is a cross-section of an artery, and that's normal. And the first thing that says there, it says fatty deposit. So if the artery is getting blood flow through it and there's some insult to the artery, the wall of the artery gets broken, opens up at all, that can occur if people are smoking or have high blood pressure, diabetes. So the body's just doing what it's supposed to do. It feels like there's something foreign there, and it sends inflammatory cells to that spot, it sends cholesterol, and you get plaque. That's this spot, first one in. If that chronic inflammation keeps going over months, years, that plaque will build up, and eventually you're going to have lack of blood flow to the heart. You get chest pain, you come see us, we put a stent in, do bypass, whatever is necessary. On the other hand, where it says rupture, if you have plaque there and the cap of the artery breaks open, again, the body sees something foreign, it does what it's supposed to do. It sends inflammatory cells, blood clotting cells, and then a blood clot, second to the last on the right, is formed there. If that blood clot occludes the artery, then we have an acute heart attack, and that's not good. So again, coronary artery disease, heart artery disease is felt to be a chronic inflammatory condition. Inflammation can affect all the other layers of the heart as well. There's an outside layer of the heart called pericardium. That's a sac that keeps the heart safe and lubricated. You can get pericarditis, which is an inflammation in that area. That can occur after a viral infection or after COVID and various other things. Congestive heart failure is also associated with chronic inflammation. So what happens there is inflammation affects the inner lining of the heart, not the arteries, but the inner lining where the blood flow is getting pumped out to the body. And that leads to scarring and eventually damage and weakening of the heart muscle. Now, chronic inflammation itself is promoted by smoking, obesity, high cholesterol, blood pressure, diabetes, but it's also associated with other chronic inflammatory conditions like periodontitis and chronic inflammation in the teeth. It can set off this chronic inflammation pathway. Chronic kidney disease, rheumatoid arthritis, COPD, a lot of these chronic inflammatory conditions will associate with chronic inflammation and heart disease. So we got chronic inflammation. How do we detect it? What do we do about it? The way we detect it is a blood test called C-reactive protein, or high-sensitivity C-reactive protein. That's a non-specific marker of inflammation. It'll tell us that inflammation is going on. It just doesn't tell us where. So it can be associated with a traumatic event if it goes up, if there's arthritis, cellulitis, anything like that. But it is useful for detecting chronic low-level inflammation from the heart standpoint. And we find that C-reactive protein is at least as strong a risk marker for heart disease as LDL, as bad cholesterol. So you turn over onto the side there. If you have a C-reactive protein level less than 1, it's low risk, and that's good. If you're between 1 and 3, it's moderate risk. And over 3 is usually higher risk for chronic inflammation and for underlying heart disease. Over 10, however, means something else is going on. You have an infection, you have arthritis, you have something else. And you usually have to repeat the C-reactive protein after that acute insult is taken care of. Now, when we look at LDL and C-reactive protein, that's the next bar chart below there. If you have LDL with bad cholesterol less than 70, C-reactive protein less than 2, your risk for death is really low. That's the one all the way on the left. If you have LDL over 70 and C-reactive protein is low, it's still pretty low risk for heart disease here, or cardiac death. However, if the LDL is less than 70, C-reactive protein is elevated, you can see there's a jump in cardiac mortality there, just based on inflammation, and the LDL is still normal. Obviously, the worst thing is if you have bad LDL over 70 and C-reactive over 2. That's the last one on the right. That's the highest risk for cardiac death and problems. All right, so we can detect chronic inflammation. How are we going to treat it? And first and foremost is lifestyle changes. So stopping smoking is obviously a good one. Losing weight, treating blood pressure, cholesterol, diabetes. Physical activity, doing a walk, lowers your C-reactive protein level. So we've all heard this stuff many times before, and it really works on multiple levels. You know, all of these things lower your risk for heart disease and lowers your risk for inflammation. So aside from physical activity, we talk about diet all the time. Diet is vitally important for chronic inflammation. There are pro-inflammatory diets, things that will increase the risk for inflammation and heart disease. Again, I gave you a little bit of a cartoon on the next page. Pro-inflammatory stuff versus anti-inflammatory things. So pro-inflammatory foods are red meat, processed meat, refined carbohydrates, sweetened beverages, things that we should be trying to avoid. Anti-inflammatory diet is the Mediterranean diet, especially when you couple it with olive oil, nuts, and fatty fish. That diet lowers C-reactive protein, lowers the risk for chronic heart disease. Again, anti-inflammatory foods are green leafy vegetables, whole grains, fruit, tea, coffee, and so on. Wine is in there too, but I didn't put it in my talk. Let's see. Now, what about medications? So, statins, Lipitor, Crestor, Simvastatin, Pravastatin, statins to lower cholesterol, lower both the LDL and bad cholesterol, also lower C-reactive protein. When the statins were first coming out, we realized this, and we figured out that maybe one of the reasons why statins do such a good job of protecting against heart disease is because of that anti-inflammatory property. One of the newer agents, bempedoic acid, Nexletol, also is a cholesterol-lowering agent, but also lowers C-reactive protein by 20 to 30%. So that's good as well. Other medications include colchicine. Colchicine is a very old medication that we use for years and years for gout. Gout's an inflammatory condition. You get red, hot joints from uric acid in the joint space. People get colchicine, anti-inflammatory, gets it better. But low-dose colchicine also lowers the risk for heart events and lowers the risk for C-reactive protein as well. So we do use that as well. And we use colchicine for pericarditis, inflammation around the heart as well. On the next page, I gave you a big chart here, which you certainly don't need to know, but just get a flavor of it. It's just all the medications that people have tried to see if this reduces chronic inflammation. And again, nothing has really been standing out that we need to start using now, but again, there's active research on all of this stuff, and stay tuned. What else can we do to lower chronic inflammation? Well, it turns out the shingles vaccine works. Since shingles is a bad condition, you get pain, you get this rash, very good to not get shingles. The vaccine we had talked about in the past lowers the risk for dementia by about 20%. So on the last page, there's 4 areas of the world that looked at shingles vaccine, and Wales, Australia, Canada, the US, all about 20% reduction in dementia with the shingles vaccine. So a couple of good reasons to get the shingles vaccine: protect against shingles, lower risk for dementia. And now a third thing, it just was shown that shingles vaccine lowers the risk for inflammatory scores and actually may slow the aging process. So get your shingles vaccine, get younger, to some degree. So multiple reasons to consider that if you haven't already. So this is the year of the fire horse, the high energy, rapid change year. So I gave you a whole bunch of tools to look at and use to try to decrease your risk for chronic inflammation, keep you on track, and keep you in the horse race. Thanks very much for coming out, everyone. Next walk with the doctor is April, so maybe we'll go outside that time. Thanks much.
Thank you, doctor. How long do I